Good morning and welcome back. Well, it's a problem that affects approximately 30 million kids and adults in the U.S. We're talking about diabetes this morning. Barb Kaufmann from Gunderson Health System is here this morning to help us look at this disease a little more and the importance of managing it. Barb, thanks for joining us.
You're welcome.
So diabetes is kind of an all-encompassing term. There are a lot of, or at least a couple of different distinctions under that umbrella term. What are they?
Well, the main two types of diabetes are type 1 and type 2, the most common being type 2. The majority of people with diabetes have type 2.
Yeah, it looks like 95% of people will have type 2. So what can we do if we do have it to manage that? What are some tips for people?
The main things that we can do to manage our diabetes would be to manage weight and stay active, eat a healthy diet. So those environmental factors that we really can influence are the things we want to work on.
So what are some of the things that can happen if you don't take care of yourself?
Some of the main complications related to diabetes, certainly it affects throughout our body. It's a leading cause of heart disease. It can affect your eyes, it can affect kidneys, it can affect nerves. So it's a very costly, potentially costly disease, but well-managed diabetes certainly can really reduce the risk for those complications.
Right, and something that can be managed. But according to the American Diabetes Association, 1 in 3 people have pre-diabetes. Can you talk a little bit about that and how you can maybe have it without even knowing?
Yes, pre-diabetes as well as diabetes itself. Many people who have both pre-diabetes and diabetes, type 2 diabetes, are not even aware they have it because there are symptoms, some common symptoms, but not everybody has symptoms that tip them off to the fact that they may have either pre-diabetes or diabetes. So I think the main thing is that if you have a family history of diabetes or pre-diabetes, that you go in and be tested.
Yeah, I was just going to say that. When do you want to look at? What are some of those telltale signs? You say not everybody has them, but what maybe is one of the things or a couple of the things that could tip you off that, hey, this might be something I have to deal with?
Well, some of the more common symptoms possibly that people may experience are increased thirst, urinary frequency, occasionally wounds that don't heal, just fatigue, chronic fatigue that they can't seem to shake. And again, many people don't have symptoms.
Yeah, something to be aware of. Barb, we are running out of time this morning, but we appreciate you taking the time with us to talk about diabetes this morning. Thank you.
Sure.
6:40.